Hello, good evening. This is Matthew Giesman here, recording for the final practical exam for EENT. So the first thing I'm going to do is introduce myself. Hello, my name is Matthew. I'm going to be your intern today. We're going to do some tests on your, or some exams on your anterior neck and your TMJ. And so the first thing I'm going to do is inspection of the neck. So we're going to look and see that the trachea is midline. Some conditions that could cause the trachea to deviate are a tumor, a large pleural effusion, or a large pneumothorax. So we see her trachea is down the middle, which is good. Can I have you pull your collar down so I can see the base of your neck and clavicles? Good. So now I'm going to have you swallow, and we're looking at the trachea to make sure that it stays in line. Swallow one more time, please. Okay, so now we're looking at the base of the neck to see if a substernal goiter has been exposed. So we're looking for any swelling around the thyroid gland. So then the next thing we're going to do is check for the mobility of the trachea. So I'm just going to have my fingers and thumb on either side, and patient, I don't want you to talk or swallow, and I'm just going to move it back and forth. And the trachea is mobile, which is normal. An abnormal finding would be that the trachea is stuck, and that could be indicative of a tumor. And so the next thing we're going to do is palpate the thyroid gland. So I'm going to use 3 fingers, one on the cricoid cartilage, and move off to the side, and we're going to just palpate. A normal thyroid gland will not be palpable. It's very soft, potentially some palpation there. So then we'll do that on the other side, and we're just going to be noticing any swelling, any nodules, any tenderness, and a single nodule on the thyroid gland would be more indicative of a tumor, and many nodules would be more indicative of a systemic disease like hyperthyroidism. So now we're going to do the TMJ examination. So the first thing I'm going to do is do inspection. So we're going to look for any tenderness or redness in front of the ears at the TMJ, and we're good. And so now I'm going to palpate on either side. So we're going to come just in front of the tragus, and I'm going to have the patient slowly open her mouth and close her mouth. So we're feeling for any deviation to either side or asymmetry in the jaw motion. And we're also going to be noting any clicking or snapping, popping noises, which could be normal. Thank you very much. And now, patient, I'm going to have you open your mouth as wide as you can. Should be about 3 fingers width. And I'm going to have you protrude your jaw out. Good. So we're checking the joint, or the range of motion of the TMJ. So now I'm going to check her muscles of mastication, which are cranial nerve 5 controlled. So these are the masseters, so bite down for me, please. Okay, and bite down, and these are the temporalis muscles. We would also check the internal pterygoids by going in through the mouth. And then we're going to check the motion of the jaw on each side, so resist, and then push to the left, resist, and now push up, and then push down. Good. So she's got normal strength in the muscles of her jaw. And so now we're going to do the Chavostic sign. So we're going to tap the parotid gland, and a positive finding would be tetany of the ipsilateral facial muscles, which would be an indicator of hypocalcemia. So that's Chavostic sign. And that concludes the exams. Thank you for watching.